Good morning, everybody. My name is Teresa Valentino. I am the author of Dear Jimmy, What a Child Trafficking Survivor Wishes You Knew. And I'm making this video to give people a little explanation of why I had to call the ambulance and go to the hospital last week. Thank you to everybody who volunteered to be my point person for closing down the blog in case I do pass away, because I don't have a lot of people in my real life. So I really appreciate you guys for that, and I will get back to you. I'm working on doing like a living will where I will figure such things out, okay? So here's what happened, basically. I have a couple of different minor health conditions. Basically, I'm disabled because I'm really fat and it has messed my back and my legs up really bad. And it's kind of a decreasing spiral. It's one of these situations where I was always a normal weight until I was trafficked as a child and I got sexually assaulted some unknown number of times by some unknown number of random weirdos, and then I never got any help for that. So it's one of those things where I've thought about this quite a lot, and the day that I had to call the ambulance, in fact, I had just left a therapy session where I was discussing this with my therapist. We've been talking about this for several weeks. Most of my life, the biggest challenge to me being able to live the life I want to live and do what I want to do has been my mental health. Like, there's no way I could get my weight under control because my mental health was in the toilet. It was all I could do to really get stable enough to survive and move forward. And what I realized, like Sandy wrote in and was asking, well, you know, how do you understand your higher self? So this situation where I had a heart arrhythmia and I had to dial 911, that was my higher self giving me a little nudge, okay? Because I had, as I said, I had just been talking hours earlier at my therapy session. I had been discussing with my therapist how I'm going to turn my physical health around, lose some weight, and get back into shape so that I can live an active life. This is the real problem. It's no longer my mental health. And I guess that's something that I would not have known to understand had I not had this little critical incident. And then this is how your higher self works. It'll just kick you in the tits and then you have to go, oh my gosh, I have to redirect. So I want to say I'm shocked, stunned, and amazed that I did not panic at any time about any of this. Like, I'm not trying to do a spoiler alert, but anyway, I have wicked hot flashes. Like, I sweat all night long. All night long, it's a battle for me of hot, cold. Like, I'm pouring sweat down my neck and between my boobage, and my legs and feet are fucking cold. Okay, so I gotta put the blanket over this part, open up this part like this to the fan. Holy mackerel. So all of this stuff, I think, will be a lot easier for me if I can lose a bunch of weight. I would like to lose about 140 pounds, and that might sound ridiculous or drastic to you, but if I did lose 140 pounds, I would still be overweight by a lot of people's standards. So, anyway, I get these things because of my hot flashes and because I get vertigo. I have these situations where sometimes I will start to feel a little moment of panic, like, oh my God, I can't breathe. Just out of nowhere, I'll just start to feel a little panicky. And then I take a nice breath and I go, no, I can breathe. What's up? Oh, I see. And I'm starting to feel hot. Okay, so this is obviously some kind of a hormonal situation, right? Where, the panic comes probably from a little adrenaline rush, epinephrine rush. So I get these little panics, and then sometimes I want to throw up, and sometimes if it gets real bad, it'll get bad to where I start puking and I have vertigo, like being seasick on dry land. That wasn't really what happened. I get much more common for me to get a little heart palpitation sometimes with this hot spell and a little panicky shit, and sometimes there's a little palpitation with it as well. So, but normally what I do is I'll just take a nice deep breath and it just resolves after 1 or 2 deep breaths. That's it. It's never been like this before. So I was sitting here checking my Twitter because I'm trying to get more Twitter followers. And if you do want to follow me on Twitter, for now, please just follow my other account, Artnunymiss, ARTNUNYMISSS on Twitter, and I will follow you back. So I was just working on my Twitter feed, trying to get my Twitter follower thing happening, and I started having palpitations. It did start out the same way with a little bit of panicky feeling, and then I started to feel a little bit hot, and then I got a palpitation. And so I know the drill on that, and I know not to panic or whatever, and I just, okay, and I did a couple of deep breaths, and it did not stop. So Then I stopped what I was doing and I just started doing deep breathing exercises. And after a few minutes, that still didn't stop. So I went to lie down on bed and lie flat and just take nice deep breaths and don't do anything else and see if I can get it to stop. And no. And after a few minutes, then my left hand started to tingle. And because I'm a veteran paramedic, I knew that I had to dial 911, so I did. So they came over here, lights and sirens, because that thing, what they saw on the monitor, is called atrial fibrillation, okay? So the only reason I'm able to explain the actual cardiac process or where I'm at with it is because I'm a veteran paramedic. Like, I'm kind of horrified that they didn't really explain stuff to me. Like, they didn't explain what exactly had happened there. Like, why did they put me on blood thinners? Isn't that beautiful? Nice bruise on my hand from the blood thinners. They didn't explain to me why they put me on blood thinners, but they didn't have to because I knew. So I made an appointment with a real cardiologist because I'm getting a little bit ahead of myself. I don't want to do a spoiler alert, but that cardiology consult did not work for me. So the funny thing is, the ironic thing or the paradoxical thing is that all my life, since I was like 7 years old, like I got sexually assaulted as a 7-year-old and then I started putting on weight. And that's really, really common. It's one of the most common indicators of childhood trauma or abuse is people who are overweight. So I remember one time as a young woman, back in the day when I was very healthy and I could run a 5.5-minute mile, well, not maybe that fast, maybe like a 7-minute mile then. And I went to a doctor for a bladder infection, and he tried to put me on a drug combination called Fen-Phen. If you guys remember that from back in the day when they were trying to give everybody Fen-Phen, which ended up like ruining the valves in your heart so that you could lose weight. So I walk in for a bladder infection, and the doctor says, I assume you're here for help controlling your weight. And I was like, well, no, actually, I think I have a bladder infection. He said, okay, well, here, so take some Fen-Phen. You know what I mean? It's like, okay, give me the antibiotic, bye. Because even then, that was just too off the hook abusive. I mean, really, since then, I've had several doctors who did not want to treat me for anything except my weight, okay? So it was a little ironic to me that after I was brought to the hospital on an emergency basis, like the ambulance had the lights and sirens on when we left my building, which confirmed for me that, yeah, I'm in AFib now. I'll explain this in a minute, but so I knew they were talking about me, but not to me, like amongst themselves, and I understood what they were saying, which is where it becomes really fucked up. Like, if you don't know what they're talking about, that's fine. But so they did not put me on any oxygen, which I found really strange because my heartbeat was irregular and ranging anywhere from 130 beats a minute to like 180 beats a minute, which is an easy way to die. Like, it was starting to be where the bottom portion of my heart was starting to kick in to try to get me to circulate properly. So why they didn't put me on oxygen, I don't know. As if I would have had a patient like that and I didn't put them immediately on oxygen, as soon as I got the IV, the O2, the monitor, in that order, they would scream, literally scream like a fucking honey badger in my face. IV, O2, monitor, every time. You know, so, because if they start to go bad, like if their heart just kicks out and can't do it anymore, you need that IV already in place so that you can push the cardiac drugs to start working the CPR, right? The next thing you need is the oxygen because that will calm the heart down. And then you got the monitor so you can see what it's doing, right? You got to do that when somebody's about to die. So if they, you know, they then took me to the hospital, which is only a couple blocks away, but they did put the lights and sirens on, which I knew they would, because I would too if I was the paramedic on this call. And then because I was a paramedic, I was like really tempted to be super panicky about that too. It was like just a series of things that should panic me by rights, but didn't somehow, because I have turned a corner in my mental health. Like, I know that there's a good outcome for me. I see that the world is kind of going over the falls in a barrel right now. And I've also seen that I survive and I do well and I come out in a place that I'm glad to be. And I do that by staying glad in each of my moments now. So, as I said in the beginning, I think I've finally turned a corner where it's no longer my mental health holding me back. Now it's really my physical health, and this is my higher self's way of showing me that I've turned that corner, and this is how I need to like sort of take a different perspective of myself and my future process, if that makes any sense. So so atrial fibrillation is something that when I was a paramedic, we had a nearby place called Pinehurst, North Carolina, and that you may be familiar with. It's where a lot of old rich white people retire to play golf. Like Tiger Woods should be the mayor of Pinehurst because it's just all the old white people. And a lot of them are in this rhythm that I had, which is called atrial fibrillation. So the heart is like a 4-part sump pump. You've got the 2 little ones at the top and the 2 big ones at the bottom. Blood comes into the top, gets collected by this one, pushed into the bottom one, and then it dumps by gravity for the most part, and then 30% is that last little push to get that last little bit of blood out the bottom, right? And then it goes into the big one, and then goes, and then it goes all the way through the body, right? So when people get old and their hearts get tired, what'll sometimes happen is they lose the atria, the top portion of the heart, the top 2 little chambers, which empty mostly again by gravity. The blood will drop out of there from gravity into the bottom chambers, but then it gives it that last little squish. That's like 30% of your heart capacity, is that last little push when it pushes the blood down into the ventricles. So when people get old and their hearts get tired, the electrical system will start to get wonky in there. And then they'll just start like their heart, the upper chambers, the atria will stop actually pumping. They'll just sit there and go like this. And then as the blood comes in, it just kind of goes and falls through by gravity, but it doesn't have, it's not squeezing it out like it's like not rinsing out your little sponge, right? So anytime blood is just kind of sitting there shaking, it's going to tend to clump and clot, and it makes a pool. That's when you get clots. So that puts me at a high stroke risk. Now, they gave me some drugs, but even the emergency room doctor, even at the emergency room, they did not put me on any oxygen. That freaks me out to this day. Anyway, when they pulled away and they put the sirens on, like, I already knew they were going to do that. And, like, being in the back of that ambulance and not, in, you know, being strapped to the gurney, I guess that was like a trust exercise. You know what I mean? Like one of those things where you have to stand up and fall backwards and people catch you. That's really how it was for me. You're literally riding backwards. You can't see except out the back door. And I know that we're rolling through this major intersection where people drive like knuckleheads any fucking way. Cross the train tracks and cross them again. It was just a little terrifying, you know what I mean? So I've been hit, like when I was a paramedic and I was in the back of the ambulance waiting to cross through an intersection, somebody just came and T-boned me from the back. So it's kind of like being inside a closed box and not really knowing what's happening out there, and somebody fucking hits you from the side. That has already happened to me before. So actually more than once. So, you know what I mean? I know how risky that is to run lights and sirens through the lights in that especially busy little area, because I've been trained to do it as a driver, and it's white knuckle, you know? So, because of the random craziness of so many people and so many different factors that you kind of can't control. So, anyway, they really didn't explain shit to me. As I said, if I were not already an ACLS, Advanced Cardiac Life Support provider, I would have no idea what happened or why. So there's a thing called troponin, which is an enzyme that is created when you have an actual heart attack. And so that's really the #1 question. If you have a critical cardiac incident, you need to know if you have troponin in your blood system. That's the first thing they're going to draw blood for, is for your troponin. Assuming you're negative for like street drugs, which I am. I don't use any kind, I'm not alcohol, I don't do any of that. So, and I told them I smoke weed for my PTSD and my chronic pain, and that's, you know, that is what it is. I think the weed is actually part of the problem of what happened, because I think I already explained this about what the AFib is. Yeah, I did. About when it's just kind of sitting there shaking and it's making a little pool, and I have not been feeling very energetic for the last 2 months. I wish I had that kind of energy to just sit there and lay on my horn like a douchebag. Not gonna stop, huh? Maybe it's broken. Anyway, I just haven't had any energy, which is kind of the classic thing for AFib. Like I said about Pinehurst, you know, in Pinehurst, it's just all the old 80-year-old retired white people, and we used to call that Pinehurst normal sinus, meaning it's normal. AFib is not a normal rhythm. Like if you have a new onset of that, you are at a very, very high stroke risk. So that's why I have to stay on blood thinners for a while. But people can survive for years on AFib. It's not like if you have a ventricular issue, then you're not going to survive. But the AFib people can live that way for years and years. So, but basically, it's my higher self's way of telling me to fish or cut bait, to decide whether I want to live another 20 years or so. You know, and I had to kind of think about some honest things. Like 6 months ago, I think it would have been a pretty clear thing that I would rather just peace out than do the work of losing like 140 pounds to get my life back so that I can begin doing shit that I want to do. But I think that that's really, I feel like I can do it now for the first time, really in my life. And I feel like the time is right. It's just my higher self's way of telling me that the time actually is right. So I get to the hospital and I'm there, and they gave me a drug called Cardizem, which they also then gave me a bag of fluids. Like sometimes, this is why old people are dehydrated a lot too. Sometimes dehydration can trigger AFib. It can make your heart, the electrical system will just kind of act up, and it'll just start throwing a bunch of electrical beats, and then it'll just go. I don't know what the hell it was. It might have been because I had a cold. I don't know. But anyway, so I'm feeling a lot better now. They gave me the Cardizem. If they would have given me some oxygen, I have to say I think it would have converted a lot sooner. But I don't know what their fucking oxygen shortage is about. But they did not give me any oxygen the whole time I was in the hospital. I came in there code medical, and they did not put 1 cc of oxygen on my face. That blows my mind. So, I stayed overnight, and I had no idea what had caused it. I had no idea anything. I had to call my landlord and have him to lock the front door because I was really hoping that I would go out there and they would put me on some oxygen and I would feel better and just go back inside. Anyway, in the morning when the nurse came in, and I was able to fall asleep because you know what? I kind of don't care. You know what I mean? I kind of have turned a corner psychologically where whatever happens is what needs to happen, and I'm fine with it. I'm going to work with whatever the hell is going on, and I don't have to feel stressed out about it. I can just really feel like it's part of my process. So I guess in a certain way, what I feel like happened there was my life just finally, like I was like going uphill at this roller coaster, and now I'm just going down. Okay, and now shit's going to be easy for me because I insist on it. I've mastered that. If I could get all the way through this whole thing without getting into a fucked up mood or getting panicky or anything like that, which I totally did, you can do this, guys. So, I had no idea what had happened to me or if I didn't know that my troponin was negative until the morning. So ask yourself this: if you got brought in lights and sirens, taken straight into a trauma bay in the back, like no waiting in the lobby for you at the emergency room, no, you go straight to the back, and the doctor comes right over to you, that's because you're messed up. So if you think that you can have that and sleep through the night until the morning to find out whether you had a heart attack or not, I challenge you to give that a real try. So I didn't know if my troponin was even negative or what until the morning. I did convert. I wasn't feeling that great, but I wasn't feeling, I didn't get out of control like it was. But yeah, I heard the nurses talking in the morning, and they said the troponin was negative. They said my potassium was low. I thought, well, maybe that was what triggered it then. But basically, it was my higher self triggered it. It was a little way for me to decide whether I feel like my life is worth salvaging or not. And showing me that the obstacle now is my physical health, not my mental health. And that was a big question that I had. I've been wondering that for like a month or two. Like, am I going to be able to overcome this? Like, why is it that abused children usually become overweight? For me, it was very straightforward. Like, I was never overweight. I was very tall and thin. And then I got attacked. And then almost immediately, this is the benefit of therapy, is like, I get these opportunities to, when you tell somebody else something, it brings it much clearer into your own mind. It gives you perspectives that you could not have had for some reason while it was just rolling around in your own brain. So what I realized is that as a small child, like after I got assaulted, first of all, it was so overwhelming for me that I was not able to remember any of those things. So I did not know any of what had happened, but I remember wishing that, I'm trying to think of a way to say this that won't really sound sad. I felt really bad about myself because of my weight. And my mom bullied the shit out of me about my weight starting at age 7, because my mom was just not trying to acknowledge that she had really fucked up and allowed me to get very badly injured. She just was dedicated to that not being a real thing. Like, anything that's wrong with me is my fault. And my weight was definitely fucking my fault. Like, I knew as a 7-year-old that the reason people could not love me was because I was fat. Fuck my mom. So anyway, for the last, I'm going to say year, 2 years that I was homeless for a long time. But now that I have a stable place to live, ironically, I can't really get around because first I didn't have my walker, and now that I have a walker, that's all well and good, but I still don't always have money to take the bus. So my next move here is to get a bicycle. And so I realized what I need to do is just suck it up and ask my foster parents to buy me a bicycle. So I did, and they agreed immediately to do so, as I knew that they would. You may understand why I'm not really comfortable asking my friends to just buy me a $400 fucking bicycle, right? I'm 54 years old. They don't owe me anything. I call them my foster parents, but I met them when I was 37. So, but then I have to look at it the other way. They would have done this gladly for me if I had asked them 7 months ago, right? And I could have been riding a bike the whole time. My life could have been so much fucking easier if I would seek and accept social support. That's my theme for 2019. So, I thought that the cardiologist who came to see me, that was kind of an amazing thing that I need to give myself credit for too, because people like me almost never graduate from high school. That's just a cold, hard reality of the fact. Like, I have a greatly diminished life expectancy just based on the amount of abuse that I've experienced and the extent of my PTSD. So, the doctor, like anybody who's able to go to medical school, automatically had an easier life than I did. You know what I mean? They're automatically coming from a place of better privilege than me. And that has made it very hard for me to find therapists that I can work with, because you need to find someone who fits that description and yet is able to humble themselves enough to understand that the traumatized people know things that they don't know. That's very hard for a lot of people to really get past the ego thing of not being the toughest person in the room. So, the cardiologist does not feel that my weight is actually a problem. She feels that it's a mental health issue. And I told her that I'm a child trafficking survivor. And she said, okay, well, so do you know how to do meditation and those kind of things? And I said, well, yeah, I've been in therapy for a long time. This happened to me in 1972. She's like, okay, well, if you've been in therapy for 40-something years, then there's something wrong. You need to get a better therapist. And I'm thinking, Jesus Christ, really, lady? And I said, no, actually, I've only been treated since like the 80s for it, the late 1980s, early 90s, when I was able to seek help myself. And she was like, okay, well, that's still like 20 years. You probably need a better therapist. I'm thinking, my God, she just has no idea how to understand this. So I told her a very horrible true fact about my first childhood sexual experience, which is this kind of thing is so sickening and stunning that I won't even tell you guys because it would freak you out and be hard for you to forget about. Just to see if I could get her to like snap into the fact that she doesn't know what the fuck I'm talking about. You know what I mean? And like humble herself a little bit to recognize that there are things that happen to children that are almost impossible for them to just walk forward again. you know. So I told her, well, no, actually I have a really good therapist now, and I'm considered permanent and stationary on a mental health basis, which means like that's a workers' compensation term, which is how they view me through Social Security. That, you know, the prognosis for someone like me is, you know, I told her, I said I'm permanent and stationary. You're not going to get better than this, right? Like you have to be, let's say if you broke your leg at work, okay? You can't start your workers' comp claim. They can't start assessing the damage on you until they're sure that there's no more treatment to make you better. You can't get better from this. That's as good as you're going to get with treatment. Now we decide what the damages are. I'm already permanent and stationary. I'm not expected to ever get better. And she looked at me like, that's not a thing. So, you know, she just held on to the fact, and I asked her if she could refer me to a dietitian, somebody that can help me get on a program here so that I can get my weight under control. And she's like, no, your weight's really not a problem, which I think I told you guys, you know, if you go in for a bladder infection and they try to give you fen-phen because you're 50 pounds overweight, for God's sake, you know what I mean? And now that I'm really fat and I have a fucking heart problem, the cardiologist doesn't feel like I need to lose weight. What is this crazy ass world we live in? So, yeah, so basically, I've done a little research, a little kicking around. I do not want to do surgery. I think that's a little off the deep edge, and I don't trust that kind of shit, and I don't think it's necessary, actually. But I found out that they have a new thing, which is a saline-filled balloon that they just, like, it's not considered surgery. They just put it down your throat, and it's then just a balloon that takes up space in your stomach, and you have to change it every 3 months. So that's supposed to really help people, and that is used in conjunction with like a nutritional diet and exercise kind of program. So I have found a clinic near me that does that, and I'm going to go back to my doctor to see if they can refer me for that. I'm going to pretend I didn't do the research and see that my body mass index, my BMI, is actually too high to get that balloon right now. La, 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 la. So, when I talked to my regular doctor about the cardiac incident, she said that I'm not really a candidate for the surgery to lose weight because my weight is not really a threat to my health in that way that they would authorize that for surgery. And yet my weight is too high for me to be able to get that simple balloon, non-surgical, commonsensical thing. So go figure. So, basically, yeah, guys, that's where I'm at. I'm feeling really good now. Actually, it's possible that I may have been in that AFib heart rhythm for the last 2 months, and it just wasn't, the rate wasn't fast enough to feel messed up enough that I would notice it and call 911. Once it got over like 140, that's when you're having a critical heart event. And you can't, like, you can tell that your heart is not okay, and that's when you would call 911, but it could be at a lower rate and still just sitting there shaking like jelly rather than squeezing. Could have been for 2 months, because I really have not been feeling good. I've not been feeling energetic enough to get out of bed. So, now I feel really good. I walked all the way downtown the other day to the bike store, and I'm very excited. Tomorrow, if the rain is okay, I'm going to go to the bike store and purchase me a bike. How about them apples, huh? So, thank you guys for caring about it, and I'm really glad that you guys are with me, and I promise I'm going to make arrangements that somebody will shut down my blog if need be. But I do feel like I can survive. I feel like it's going to be okay, and I'm going to seek more support, and I'm going to use it. How about that? All right? Thank you guys. I really love you for caring about this and for staying with me.